Okay, now see, uh, we are going to do imaging techniques. In this, first of all comes X-rays. First of all, you should know that X-rays were discovered by William Roentgen in 1895 in Germany. Okay, second thing you should know is that first radiograph was of his wife's hand. Okay, then you should know that X-rays basically they are photons. Okay, that is a type of electromagnetic radiation. Okay, they are produced from, this is cathode, made up of tungsten filament. Both cathode and anode are made up of tungsten filament. This is anode, again made up of tungsten. From cathode, the waves are collimated by using lead. Okay, they are collimated. So that, what is the meaning of collimated? That is, they are prevented from fanning out. Okay, from fanning out. Okay, and after that, this X-ray about which I was talking about, this is also called as the plane radiography. Okay, because in this we are not using any kind of contrast. Anyways, what I have told, that what is the principle of this? In this, X-rays are generated from cathode, okay, and they pass into anode by passing through lead. With the help of lead, they are collimated, they are prevented from fanning out. Okay, so that they can go in the straight direction, okay, in an appropriate area. Now see, suppose this is the human body, and when these X-rays are passing through the human body, they are attenuated. What is the meaning of attenuated? That is, their intensity gets reduced. Okay, and this this difference in attenuation, results in difference in your level of exposure. Difference in attenuation leads to difference in level of exposure. So now see, air attenuates the least, therefore it appears black. Okay, then water, it attenuates more than air, so it appears somewhat gray. Okay, fat attenuates, sorry, 1 minute. Yeah, after air comes fat. Okay, the fat attenuates more than air but less than water. Okay, and third is water. Okay, it also appears somewhat gray, but as compared to fat, it is slightly white. And next is bone. Okay, it attenuates at maximum, so it appears white. Okay, it attenuates its maximum because of presence of calcium. Okay, so whenever we will see the X-ray, the bones will appear white, water and soft tissue, that is, and fat, they all will appear gray, and air will appear black. Okay, so this is the principle of X-rays. Okay, as you can see in this picture, as you can see it in this picture, this is the cathode, this is the anode, this is the glass X-ray tube, this is the tungsten filament. Okay, and this is the tungsten target. Like both cathode and anode, they are made up of tungsten. Okay, and whole procedure occurs in the glass tube. Okay, so this was about the X-ray. Now we will discuss plain radiography. Now second is the your second is contrast angiography, that is using contrast. Second is contrast angiography, contrast radiography. Okay, the contrast which is normally used, it should attenuate the X-rays. Suppose this is mainly used for our GIT. Okay, especially the bowel loops and arteries. Okay, and the substance, it should attenuate more than air. Okay, so that we can see it clearly. So we have to fill the this bowel loop and arteries with some contrast agents. Okay, for example, for contrast we use barium sulfate. Okay, and this we can give it in 3 ways. Barium swallow test. There are three types: barium swallow, barium meal, and barium enema. Okay, so why we use the barium sulfate? First of all, because barium sulfate, it is non-toxic. Okay, barium sulfate is non-toxic. Okay, and it is an insoluble salt. Okay, and it is high density it has, so it is useful for GIT loops we check. Okay, so first of all, when the barium sulfate is ingested, okay, it attenuates the air, it attenuates the X-rays. Okay, and then we can see the bowel lumen, because otherwise it will appear black, but with the help of these contrast agent we can see the bowel lumen. And one is the double contrast study, in which air is also instilled. So both air and barium is used. Okay, then it is called as the double contrast study. Okay, and this was for your GIT loops, that is bowel loops. We can check through the barium sulfate. But if they are vessels, for vessels we use iodine. Okay, now see, this is an example of barium sulfate follow through. Okay, now see, this was about the bowel loop demonstration. Okay, but for vessels we use iodine as a contrast agent. Why we use iodine? Because it has high atomic mass. Okay, and it markedly attenuates the X-rays. Okay, and thirdly, the most important, it is excreted via urinary system. Okay, so because of this property, we can visualize urinary system also, like kidney, ureter, bladder, etc., which is called as intravenous urography. intravenous urography. Okay, and after that you should know that apart from this, uh, uh, these are basically given as intra-arterial or intravenous injection. ठीक है, this is iodine. Okay, clear. Next we will do subtraction angiography, ultrasound, etc. This was technique 1.